Hello, friends. Steve Borene from Renovo Health here. I wanted to just discuss a little snippet from the other day's State of the Union address. I haven't seen it myself yet. I was occupied otherwise, taking care of patients, but I had a few people make some comments on some of the things that our president has said, and wanted to have a chance to go ahead and weigh in a little bit in response.
I'm also confronting one of the biggest ripoffs of our times, the crushing cost of health care caused by you. Since the passage of the Unaffordable Care Act, sometimes referred to as Obamacare, big insurance companies have gotten rich. It was meant for the insurance companies, not the people. With our government giving them hundreds and hundreds of billions of dollars a year, as their stock prices soared 1,000, 1,200, 1,400, and even 1,700%, like nothing else. That's why I introduced the great healthcare plan. I want to stop all payments to big insurance companies and instead give that money directly to the people so they can buy their own healthcare, which will be better healthcare at a much lower cost.
Yeah, that's what we're doing at Renovo. That's great.
In addition, my plan requires maximum price transparency. That's a big deal. Sounds so simple, so big.
It is simple.
And I did that in my first.
Well, there you go. Those are great ideas. What we're doing already at Renovo Health. Transparent costs. I mean, transparency in itself is important, but isn't the end all. Transparency is the beginning of the conversation. So having our prices available on our website is the beginning of the discussion. And from that is where a better patient experience, higher quality of care, everything else that people are really looking for can fit in. So the idea behind Renovo Health and the same things that the president is encouraging is accountability in healthcare between the physician and the patient, connecting buyers and sellers, making it a more transparent transaction instead of running things through other levels, other middlemen that don't need to be there. The Accountable Care Act was designed by hospitals, insurance companies, big pharma. Wasn't designed by employers, physicians, the people who are really important in the interaction of healthcare. The idea is that you're purchasing coverage or that you're getting a product that honestly you really don't need. You're more likely to go bankrupt if you do have, ironically. What people need, what people want, and what is already being delivered at places like Renovo Health is accountable, transparent care that connects buyers and sellers directly. Eliminating health insurance, what a great idea for regular care. If we want to find a way to go ahead and protect against catastrophe, insurance is a great product for that. That's how we use insurance in every other application, whether it be our house, whether it be our crops, whether it be our auto. We use that insurance when tragedy occurs, when something unexpected and rare occurs. Healthcare, it's not being used in that same manner. We can go ahead and use regular care at regular prices, just like we purchase everything else, just like we purchase a car, and use that same insurance for that unusual occurrence, if at all. Turns out, if we have enough people that are able to go ahead and have a transparent, accountable discussion, even the most expensive care will come down just by market forces. Right now, there aren't market forces. It's a cartelized oligopoly. It isn't a monopoly. It's worse than that. At a monopoly, you can go ahead and pick out the bad player and you can go ahead and shut them down. Right now, we've got multiple bad players working together in the system that was designed intentionally to benefit them, to make physicians lose autonomy, lose agency, and patients to go broke. There is an agency among patients. There is an agency among physicians. Who's in charge? Who's the one that benefits from every interaction? The more expensive it is, the better off they do. Medical loss ratios right out of the Affordable Care Act guarantees a 15% return. It basically turned insurance companies into a utility. Now they get to keep 15%. They raise their premiums to go ahead and justify their guaranteed returns. That's why ever since the ACA passed, their stock prices are out of control. They're over the top. If you're an investor and not concerned about where that blood money goes, you're going to go ahead and be raking in your healthcare profits. If you're a patient, if you're a person, if you're a citizen who's trying to find a way to go ahead and protect themselves, get the best care, take good care of themselves, you're out of luck in that model. You need a model like Renovo Health. You need a model like direct primary care, direct specialty care. You need honest, accountable people bringing you the care that you need and that you know you need. Renovo Health is a direct specialty center located in Wisconsin, 2 campuses, one on Lake Michigan on the east side of the state, another offering GI services and infusions on the Mississippi shore near La Crosse. The flagship site by Lake Michigan has general surgery, gynecologic surgery, urologic surgery, as well as GI procedures, colonoscopy and EGD, and medical infusions. All of these are tailored for patients. They're tailored for payers with transparent costs. Right there, published on our website. We'll work with you. If the procedure you want isn't on the list, we'll talk to our specialists. It's just a starting point. Everything we put up is the beginning of a conversation, just like any other sales agreement that you make with any other product. Give us a call. Reach out to us through our website, www.renovohealth.care. We'd be happy to address where you're looking at seeking care, how we can be of assistance. And if we can't do it, it turns out it's important to us that you find that care. We'll help you find it somewhere else. But once you come in through our door, you'll be back. Yeah, that's perfect. What he was talking about, what the president brings up is exactly, I should have been in the gallery. That's right. Go ahead and speak to more transparency, more accountability in healthcare. This is the movement that exists. This is already present. This is already going on. Government just needs to stay out of the way. People just need to get on board. There's already a market in place that's allowing employers, allowing individuals to go ahead and seek care in this manner. All they have to do is call. All they have to do is go to the website. They can get this taken care of just like I took care of half a dozen patients yesterday, saved a grand total for those patients in the area of over $50,000. That ain't a bad day. Surgery days, we've done $250,000 savings. As we add more services, we might very well have a $250,000 case someday. Just being able to save that much. And that makes a difference. That's what keeps people from going bankrupt. That's what keeps people actually in control of their own healthcare.